Module Overview. As dementia progresses, one of the most profound challenges caregivers face is effective communication and behavioral management. In this module, you will explore the neurological basis of communication decline, understand how to interpret nonverbal cues, manage challenging behaviors, and build compassionate, patient-centered care interactions. Effective communication is more than just speaking. It involves active listening, body language, tone, emotional control, cultural awareness, and behavior interpretation. This module trains caregivers to remain responsive, not reactive, and to handle behavioral challenges such as agitation, aggression, sundowning, paranoia, resistance to care, hallucinations, and wandering, all in a safe, respectful, and therapeutic manner. Learning objectives. By the end of this module, you will be able to understand the impact of dementia on verbal and nonverbal communication. Apply appropriate communication strategies tailored to different stages of dementia. Identify common behavioral symptoms in dementia and their causes. Apply behavior-based care models, such as the ABC model, antecedent behavior consequence. Use therapeutic communication to de-escalate tense or emotionally charged situations. Promote dignity and empathy in all interactions. Document and report behavioral changes professionally for care planning. How dementia affects communication. Dementia disrupts language processing, difficulty understanding or forming sentences, word finding, anomia, speech fluency, comprehension of spoken/written language, ability to follow instructions, nonverbal signaling, facial expressions, gestures, tone. As the brain deteriorates, frustration increases due to inability to express needs. Behaviors escalate when verbal language fails. Common communication challenges. Communication barrier. How it appears. Word confusion, calling a fork, a brush, repetition, asking same question repeatedly, nonsensical speech, incoherent or invented words, loss of language, long pauses, silence, pointing, reduced attention, trouble following conversation. Communication strategies per dementia stage. Early stage. Speak slowly and clearly. Use names instead of he, she. Provide choices, e.g., do you want tea or water? Avoid correcting. Guide gently. Middle stage. Use simple words and sentences. Rely more on nonverbal cues, gestures, visual prompts. Maintain consistent routines. Use calming, friendly tone. Late stage. Speak with soft tone and facial expression. Use touch, music, photos, and smell-based cues. Assume meaning even when words are lost. Observe closely for pain, fear, or discomfort signs. Understanding behavioral symptoms in dementia. Behavior is a form of communication. When words fail, behaviors express needs like behavior possible. Cause, wandering boredom, searching for familiarity, yelling pain, fear, frustration, resistance to care, loss of control, confusion, hallucinations, neurological deterioration, sundowning, late day confusion, fatigue, low lighting. Causes and risk factors. Age, most common risk factor. Genetics and family history, e.g. APOE4 gene. Cardiovascular issues, e.g. high blood pressure, diabetes. Head injuries or traumatic brain injury. TBI, poor diet, smoking, and sedentary lifestyle, depression, and isolation in later life. Behavior management techniques. ABC model. A. Antecedent. What happened before the behavior? B. Behavior. What was the actual behavior? C. Consequence. What was the result or caregiver's response? Using this model, caregivers can track triggers, patterns, and adapt care plans accordingly. Key techniques. Redirection. Gently shift the person's focus. Validation. Therapy. Acknowledge feelings even if facts are incorrect. Distraction. Use objects, music, or favorite activities to ease distress. Environment control. Reduce noise, clutter, overstimulation. Routine. Familiar schedules reduce anxiety. Empathy and dignity in behavioral care. Don't argue or confront directly. Use person-first language. Person with dementia, not demented. Respect boundaries, even in intimate care like bathing or feeding. Involve the individual in decision-making where possible. Maintain eye contact and smile often. Remember, behaviors are not personal. They are symptoms. Documentation and reporting. Documenting behavioral incidents helps identify trends and medical triggers, inform medical teams, protect caregivers and institutions, legally adjust medication or therapeutic strategies. Example of documentation. Client became agitated and began pacing at 4:30 p.m. following a loud noise. Spoke calmly, redirected to music. Behavior, de-escalated in 8 minutes. No physical aggression observed. Family notified. Professional insight. Consistent communication and calm, respectful behavior. Management can reduce the need for psychotropic medications and lower caregiver burnout.